If you have heart problems, stomach problems, high blood pressure, sleep apnea, fatty liver or diabetes, then this video can give you the solution to all of these problems. Nowadays, modern medical science is so advanced that it can shock the world. Especially the laparoscopic surgery is a special one, which is performed with computer and robot. So patient can overcome the pain easily. In the same way, nowadays various modern surgeries have been invented to reduce the weight of human beings. Most of the surgery are performed without cutting. Gastric balloon surgery is one of them. So here we talk about who is suitable for gastric balloon surgery, how gastric balloon surgery is performed, how does a gastric balloon surgery actually works. So welcome to today's new episode. Who is suitable for gastric balloon surgery? Gastric balloon surgery performed who are overweighted people, and that obesity causes various diseases just like heart disease or stroke, high blood pressure, sleep apnea, fatty liver, type 2 diabetes. These diseases are closely linked with being overweight, and so it is very important for these people to losing weight, and gastric balloon surgery is used for your rapid weight loss. But it is most important factor that who needs to losing 30% of their excess body weight, he is suitable for this surgery. Otherwise, gastric balloons are not suitable for them. How is gastric balloon surgery performed? The gastric balloon procedure is performed by specialists in the endoscopy unit. During the procedure, the doctor inserts a thin tube or catheter into the abdomen through the neck. Next, the doctor uses an endoscope where a flexible tube enters the abdomen with a camera. The camera helps the doctor see the balloon. This balloon is usually made of silicone, which is filled with saline. The procedure takes about half an hour. You can easily go home 1 to 2 hours after the procedure is over. Intragastric balloons are placed in the abdomen for up to 6 months and then removed using an endoscope. After 6 months, it is basically removed, and if necessary, a new gastric balloon is inserted again in stomach, because after 6 months the balloon will be expired. How does a gastric balloon actually work? The main purpose of inserting gastric balloon in our stomach is to reduce the amount of intake in our human body. Having a gastric balloon in our stomach makes our stomach feel full, which makes us feel less hungry. As a result, the stomach gets full after eating less amount of food. In this way, gastric balloons help us to lose weight very quickly. However, the gastric balloon may feel uncomfortable for the first time, which is very normal. But gradually it will get better.